Rushanara.
Thank you, Madam Deputy Speaker. And I want to start by concurring with the Honourable Member for Wickham, because while this is absolutely the right thing to do to support this legislation, we must make sure that the scrutiny remains and that his warnings are heeded by the government and the warnings of those of us on this side of the House. Can I start off by setting out my deepest sympathies for those who've already lost their lives in my constituency, but also around the country, and also pay tribute to the emergency workers around the country who need our support right now, but also need direct, immediate action from the government to give them the PPE equipment that they are lacking. Madam Deputy Speaker, here in London, we're at the front line, and in my constituency and around the city, these are densely populated areas with huge amounts of overcrowding, intergenerational living, high health risks, which means we face, ahead of the challenges that are spreading around the country, we face challenges now. And in the last week, we have had several reports of major problems in my constituency. The Royal London Hospital doctors have already said, clinicians have described the situation like a war zone, and others have said that already they're having to make decisions that will be devastating, choosing between who to save and who dies, and the collateral damage that they speak of. Doctors having to order equipment online. So I want to echo the importance of making sure that PPE equipment is sent to people immediately. Care home outbreaks that are of great concern around the country, vulnerable people at risk. So I wanted to just raise a few questions for the Secretary of State. The first being that we need to make sure hospitals like the Mildmay Hospital doesn't close on the 31st of March, as is still being planned, which is utterly scandalous to see AIDS sufferers who need care being thrown out of hospital into the NHS when the NHS won't be able to cope. I also asked the Secretary of State to make sure that councils like mine get the help they need, because they're at breaking point already. My discussions last week have highlighted just how difficult it is for them to be able to feed some of the poorest people in the country, and other councils will have the same problem with millions living in poverty, and this is going to trap them into complete devastation. We need action now for councils. GPs are reporting that they're running out of inhalers in other constituencies that my colleagues have fed information to us to pass on to government ministers. And the government needs to act to ensure that the 1 million or so undocumented workers who will continue to work if they are not stopped and if they are not given an amnesty is going to be a risk to public health, and I hope that the government takes that on board, and I imagine that this is not something that's been addressed yet, because that is also a public health emergency. On burial, I welcome what the government is doing, and I congratulate my honourable friend for her leadership in this, but we need to make sure local authorities work together to ensure that the burial facilities are available. Finally, Madam Deputy Speaker, there are many thousands of people who are going to be stranded in other countries. We need an evacuation plan in the light of the Prime Minister's remarks to get them back to our country, back home safely. I thank the Minister for her work and the government's